Good morning. As you know, healthcare reform is front and center in Washington. The House and Senate recently passed a budget resolution that included well over $600 billion for a first down payment for healthcare reform. I want to talk to you about three things. First, last month was an unbelievable month of mobilization. 327 congregations rallied that included 50,000 parishioners in 144 cities to sound the alarm for healthcare reform. In addition, we gathered over 5,000 personal stories from people calling on a need for healthcare reform. In addition, we started a series of out in front campaigns that involved 6 to 7 congressional districts that involved hundreds of people out in front of their congressperson's office demanding healthcare reform. Second, we're on fast track in Washington, D.C. The House and Senate have started a process now of debate and discussion to move healthcare reform very quickly. We're looking for the House and the Senate, different committees, to pass legislation by the end of June before the 4th of July recess, and then to come back during the month of July and to actually pass and vote in the full House and the Senate on healthcare reform, and having President Obama sign legislation in August or September. With that, there's a lot of mobilization that we still need to do. The forces of do nothing, the forces of the status quo, the forces of continually making profit off the current healthcare system are going to be out there mobilizing people. We've got a couple different events going on. One is on May 2nd, where there's second out in front campaigns that are going to be happening in 6 to 8 different congressional districts. And the theme of it is going to be small businesses, talking about why small businesses need health care reform. And lastly, in May, during the Memorial Day recess, we're going to be doing town hall meetings throughout the state of Illinois that we're going to be calling our Congress people to be at those town hall meetings to hear you, and so that they understand your demand and your call for health care reform. We also understand that those forces of do nothing are also going to be out there mobilizing. So often when we talk about the cost of doing nothing and the cost of inaction, we're talking about the financial hardship that it's having, that healthcare is having on small businesses, large businesses, Illinois families, the provider community, and governments. There's also a cost of inaction on our part, that if you don't pick up that phone and make that phone call, don't come to a public hearing, don't contribute to this fight, that cost of inaction could actually mean the insurance industry grows and other corporations who are making a profit off our current healthcare system continues to grow. I know you're not going to allow that happen, and we're doing everything in our ability not to allow that happen. Lastly, I want to talk about that when I talked to you a few weeks ago about this unique opportunity with the Nathan Cummings Foundation, that they are going to be matching dollar for dollar up to $25,000. We were short about $4,000 several weeks ago. I'm proud to say we're barely under $1,000 right now. And that means 50 of you out there doing a contribution of $20 or 10 of you making a contribution of $100. We need your help. We need to secure these resources so we can pump more resources into this fight over the coming months so we can win affordable, accessible, guaranteed quality health care for everyone. Don't allow the cost of inaction to win. I know you're not going to allow that happen, and I want to thank you for your continued fight in this effort. Thank you very much.